One of the things we know is that anxiety and depression happens comorbidly. It happens comorbidly pretty often. I think initially, right, we're trying to establish this baseline. So every initial assessment is going to have a PHQ-9 and a GAD-7 completed from that patient. So we might uncover at that time that they don't have depressive symptoms. So let's just choose someone who doesn't have depressive symptoms at initial, but does score higher on the GAD-7. We start treating them for anxiety. But then maybe over time, what we uncover is that as we start to like better the anxiety, some of those depressive symptoms start to pop up. And so it's important that we track it pretty regularly. And so those assessments are attached to every single appointment that happens in our system. If we are tracking it specifically for a patient, we will prompt them to complete it at the onset of that session for that reason. It helps us understand, like, are we moving the needle? Is what we're currently doing impacting this individual's mood? Is it reducing the anxiety? And if it's not, then we need to know that early on. And the only way to do that is if you're tracking it and looking at it. Then you can pivot, right? So if for a med provider, it might be like, okay, we've started something for anxiety, but it's not working. We need to try something different. Or, if I'm treating someone for anxiety in an outpatient setting and maybe what we're targeting isn't working, is it something else? Do we need to pivot? Or at that point, like, do I need to start assessing whether this needs to be on medication? It gives us these touch points with the patient to know if what we're currently doing with their treatment plan is effective.